Okay. Hello. We are back again this week. This is...
Hi, I'm Dr. Martin Rutherford. I am a certified functional medicine practitioner. You can tell I missed last week. And I'm out of practice here. And I'm a chiropractor. We're going to mention a little bit about chiropractic today. I'm a chiropractor since 1979. We're going to talk about functional neurology. And the title is Functional Neurology Explained. And this is our functional neurologist sitting right here, Dr.
Randall Gates, board certified chiropractic neurologist, as well as being a chiropractor. And we'll go into explaining some of the nuances in the terms chiropractic neurology and functional neurology, but we'll get into that in greater detail.
So we have a practice here that has evolved into a chronic pain practice. I got sick many years ago. Make a long story short, I got sick. Got pneumonia. Next thing I know, I had fibromyalgia, chronic fatigue, peripheral neuropathy, tremors, cerebellar attacks, celiac, Hashimoto's, and more. And more. Epstein-Barr virus, and blah, 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 and all that kind of stuff. I really had all that. And the short version is I found a functional neurologist who was working out of Appleton, Wisconsin, Dr. Michael Johnson, hat tip to you. And he helped me a lot by sending me a lot of materials on how to apply some of these techniques to myself. He then referred me to another doctor in San Diego, who is Dr. Dietary Karazian. And I went to his seminars and learned about functional medicine. And that's how I got like 90% better, or more, maybe 90, 95% better. I'm a pretty normal functioning human being today. For those of you who have all those things, you could be too. And the way it happened was by kind of munching functional neurology and functional medicine together. And the functional medicine seems to be getting to be fairly well understood. I'm not having to answer the questions I used to have to answer 5, 6, 7 years ago about why are my lab tests abnormal and why doesn't my doctor know this and all that type of stuff. But functional neurology still seems to be something that maybe is just a little bit on the horizon of people starting to actually refer here for a functional neurologist. We're actually now starting to get calls that say, I want a functional neurologist. I don't care who it is. I just want a functional neurologist. I'm teasing. So, but we are starting to get those calls. And so we're going to talk a little bit more today about functional neurology, because as well as our patients get on a consistent basis, sometimes they do have a difficult time understanding what the functional neurology is. Why is it a board certified chiropractic functional neurologist? And it looks like, according to Dr. Gates's outline here, we're going to answer all that today. And this is a new horizon. This is a new field. This is a big part of where things are going to go. The brain is everything. It's responsible for everything you are, everything you think, everything you feel. And what you do, and what you find out in doing this work is that you start to become a lot less judgmental of people, because pretty much everybody comes in here with depression and anxiety because they're depressed, because they're sick and nobody knows what's wrong with them. They have anxiety because their brain's not working right. And a lot of them, without even treating them for that, but treating their brain for the conditions that they come and leave without that. So you start looking at people and go, whoa, they don't have to just pull up their bootstraps. You kind of look at them and go, whoa, this is a brain malfunction. And Dr. Gates is going to describe what the difference is between that and probably in a brain pathology. So that's kind of the lead in. I hope you stay through this, because this is the crest of the wave. This is the real stuff that is coming from the brain research, in my opinion. And I'm probably a little biased, but let's talk about functional neurology and why I make such a statement as that. History of functional chiropractic neurology is a very interesting history, and it sounds like a good place to start.
Yes.
The character.
Dr. Carrick.
Sorry, Dr. Carrick, if you're watching, which I'm sure you're not.
But Dr. Carrick deserves a lot of the credit, and we're going to go into this. He, in fact, deserves all the credit in founding this profession. Really, this starts back at the turn of the 20th century when chiropractic was just in its infancy. And at that time, there's a gentleman by the name B.J. Palmer. You may have heard of the Palmer chiropractic schools. And B.J. Palmer was very much into research and figuring out why the chiropractic adjustment was helping people, why he would adjust the neck on one side and all of a sudden their abdominal complaints would go away, or they'd feel more sensation in their feet. And so at that point, the medical understanding of the nervous system was such that the nervous system, the brain, the spinal cord, the nerves that come out into the extremities were just a gelatinous substance conducting electricity basically from your fingertips up over to the other side of your brain. And that's the information Dr. Palmer was working off of. For those who are anti-chiropractic, it's kind of interesting that Dr. Palmer was the first one to take an x-ray of the spine in North America. So he was very much into the new diagnostic testing that was available.
If he saw our office today, he'd be ecstatic. Exactly. Because so many of the things he was trying to figure out have been figured out, and they're being applied through this functional neurology.
Right. Yeah. Really what we're doing is chiropractic, but we can explain that as we go along. So it wasn't until 1937, I believe, that a neuroscience researcher named Ramon San Diego Cajal came out and discovered that our nervous system was actually made up of little cells. So we know we have cells in our skin, and we have cells in our GI tract, we have cells of muscle tissue, but our brain is made up of cells just the same way, called neurons. And Dr. Cajal, in essence, discovered this, and it changed our perception of what the nervous system is and how it communicates. So rather than just a gelatinous substance, now we have a cell in your brain maybe talking down to a cell in another part of your body, or another part of your brain, or another part of your spinal cord. So it's very interesting, because in the chiropractic model, hang with me on this, the gelatinous substance model, it was thought that if you have a bone out of place here in your neck, well, maybe that's impinging on your spinal cord or a nerve there, and that's why by adjusting the neck, all of a sudden your gastrointestinal problem gets better.
Yeah, interfering with the flow. They used to use like a garden hose.
Right,
the example.
Right.
Just put your foot on the garden hose, and the water won't go through. Take the foot off, the water goes through. And I mean, and that made sense at the time.
It did make sense.
But it turns out it's a little bit more involved than that.
And once this was readily accepted around 1947, chiropractic was kind of left hanging on to this garden hose model for a number of years. And it really wasn't until...
People still use it?
Yeah, people do. And it really wasn't until the late 1970s, I think Dr. Carrick came into practice right around the time you did. 1980, he started teaching.
79.
Yeah, 79. He started going back to the neuroscience textbooks, and he started looking at, well, how can we explain all these changes with chiropractic? I mean, chiropractors rave about, adjust the spine, the migraines go away. Adjust the spine, and this goes away.
Blood pressure changes. My pancreas started working. Right. My bowels started working. People's depression got less. I mean, I could go on. I've got Palmer wrote like 40 books, and I've got like 17 of them. The guy was a brilliant guy, and people used to say, "Oh, you chiropractors, you can't whack somebody in the neck and have their bowels start to move." Well, I got news for you. You can, but it was very inconsistent, because he didn't know exactly why it was happening. He had his theories. This is a brilliant, brilliant man. One of probably the most underappreciated scientists of the last century, in my opinion, based on, we could do hours on just on Palmer, but anyway, yeah.
And when I first came into practice with you, I remember you telling me stories of, I adjusted this guy's low back, also his kidneys started functioning.
Yeah. Pancreas.
But just as you notably said, those results were inconsistent. And so that was the hard aspect for the scientific community to embrace. And, there's a stigma with being a chiropractor, and, there are truths to those stigmas, and there are also a lot of falsehoods as well. So moving on, Dr. Carrick starts proposing this new model as to how the chiropractic adjustment could be helping chiropractic patients. And what he came across is that there are receptors in the joints, and those receptors in the joints, when you move a joint really quick with an adjustment, fire into the brain. And he started saying, well, possibly all these positive effects from chiropractic were really due to changing brain function. And that's where it all started. And from there, it has just blossomed. And he was right there at the burgeoning of, the decade of the brain, where millions and billions of dollars were dedicated to brain research. Concurrently with this time, there's a gentleman by the name of Eric Kandel. And really, there are several people working on this concept termed neuroplasticity. That's a concept that defines that your brain can form new connections, it can form stronger connections, and that can be helpful in recovering from a brain injury or a peripheral nerve injury or in learning. And Dr. Kandel really kind of plowed the way for other neuroscience researchers in this field. And he has a phenomenal textbook called Principles of Neuroscience. It's been updated several times now. He's from Columbia University. Look him up. And I was going to bring up all of our books because a lot of people say
people still come in and say, "Oh, this neuroplasticity, I've heard, it's a theory. Right. It's not really proven." I mean,
that's just insane.
There's so much data on it. It's ridiculous.
And they're citing, and we're going to get into, they cite a few articles on dementia patients where neuroplasticity failed. And so because of that, neuroplasticity is a theory. I mean, that's really where they're coming from.
And this is what we do all day long relative to most of our patients, relative to the neurological aspects of their care. And if it's a theory, it works pretty well. It's a good theory, we can tell you.
So with all this research in the decade of the brain, the amount of understanding just exploded basically from the 80s through today. But really, the explosion was big in the mid to late 80s through the year 2000, and how the brain works, not only in monkeys, but in human beings. And from there, Dr. Carrick started saying, well, we could do an adjustment and maybe help this person, but maybe we need to do another therapy. Maybe an adjustment is not the best idea for this individual, because adjustments, believe it or not, can be very powerful. They can overstimulate patients who have sensitive nervous systems.
Many of you who may have gone to a chiropractor and said, I got an adjustment. Oh my God, I'll never go back. I feel worse. I mean, some of you might have been tight. Some of you might have received a less skilled adjustment. But I can look back in time to people who got a very clean, very, very nice adjustment, and their bones moved well when the manipulation was applied, and really had a bad reaction. In retrospect, these people, we'll probably talk about low metabolic capacity. It was too much stimulation. It was just simply too much stimulation for their brain, because their physiology was not good. Their physiology was not good. Probably talk about that.
Yeah.
About autoimmunes and
we're going to go into all that
and all that type of stuff.
For sure.
Yeah.
And so then Dr. Carrick started saying, well, maybe we could apply other therapies, and that we're going to go into this also. But eye movement therapy is very, very well researched. In fact, many of my colleagues will say it's the most well-researched aspect of brain function and really rehabilitation. And so we have just thousands and thousands of studies showing that if you look at your thumb and turn your head a certain direction, or if you're turning your body, head, and thumb in unison, or if you're turning your head back and forth like this, or if you're looking at dots on a page, those all stimulate different areas of the brain and have been shown to activate these areas of the brain. And it's so interesting that neuroplasticity comes up against such criticism, because that'd be like saying, well, exercising is just a theory. I mean, that's literally, it's on the same model.
In fact, we just talked last week. I have a bad cerebellum. Maybe we'll get into that. Maybe we won't. Not for me, but cerebellum. And I've been laying low because I've been working a lot, and I've been thinking a lot, and I've been doing all this different stuff. And so with all this fibromyalgia and all that type of stuff, I can't do too much. And I'd been laying off of strengthening exercises, and I started doing squats without weights, just squats, just to get my legs strong, and some push-ups and everything. And my remaining tremors coming from my cerebellum got better.
Yeah.
So exercises for the brain, no different than exercises for the leg in theory and in practical application. I think the thing is, and you'll probably get into this, is we've tried to keep this as simple as possible here, so that people can learn to do the exercises, which you're going to get into, and people go, this is really going to help me. And hopefully by the time today is done, you'll get that, yes, these neurological exercises for your brain are very powerful. And if you're one of our patients watching, keep doing your exercises. Yeah, so.
Okay, so let's go into the successes and failures, and then we can tie in the opponents of neuroplasticity.
So different stimulations. You were talking about that. Did you want to go into that later?
Well, relative to the different stimulations, so
really
Dr. Carrick started looking at eye movement therapy. He started saying, well, if somebody has, let's say, neuropathy, maybe adjusting them is the most specific therapy. So neuropathy is where you get numbness and tingling in your legs. So maybe we need to apply some electrical current down in the legs concurrently with some other therapies.
Because it's less invasive.
Less invasive, and it's more targeted for that individual's problem. So that kind of fostered this new discipline in neurology that was being termed chiropractic neurology, because largely it was chiropractors who were doing this type of rehabilitation. It's basically neurological rehabilitation. And many of you have probably seen some of the documentaries on PBS. They have one with Dr. Amen. They've talked to Dr. Merzanich at UCSF, where they detail stroke patients, for example. They have a stroke affecting the right arm, and physical therapy in the past used to really focus on showing this person how to use their left arm so they could get through their day-to-day activity. And now they have something called constraint-induced therapy. It's been known for quite a while, at least 10 years probably. But that's where you force the person for like 6 hours a day to use that right arm, because if you constrain the good arm and they're forced to use this arm, they've shown that eventually you will make more connections in this damaged area of the brain, and there's a good likelihood that you may get more use of this affected body part than if you were to just immobilize it and go back and start using the good brain.
Or lose it.
Use it or lose it. It's a classic case of that. So that's where neuroplasticity really started to burgeon out. Chiropractors, term chiropractic neurologists, largely were using these therapies. And then opponents of neuroplasticity, like I cited before, will say, well, it's just a theory because there have been studies done using neuroplasticity-based techniques that didn't work. And some of those were done on dementia patients where they tried giving them more and more memory tests and they just can't remember. Well, the unique aspect of neurological disease is frequently there's an underlying metabolic component, whether it be genetic, whether it be accumulation of abnormal proteins in the brain associated with dementia or Parkinson's disease or autoimmune problems that don't allow the nerve cells, the neurons, to focus correct or to work correctly or to work normally. And because of that, some attempts to exercise those regions fail. Very analogous to a muscular dystrophy patient. That's where people have their muscle tissue breaking down genetically, or sometimes inflammatory muscle conditions can cause muscles to be weak. Well, you don't want to necessarily just go and start exercising those muscles because you're going to actually make them weaker. That's a very similar analogy to why some of these neuroplasticity-based studies have failed. But as Dr. Rutherford and I started joining forces, it was really around the time that other practitioners started bringing in functional medicine with functional neurology. So what does that mean? In our clinic, a lot of our patients, for those of you watching or prospective people watching, one of our patients really recommended this talk, and she has like 10 people who want to come in and they want to understand.
Well, I hope you're watching.
Yes, she is watching. And hello, I'll talk to you later this week. But our patients largely have inflammatory and autoimmune issues. They have inflammation coming from their gut. They may have insulin resistance, which is being shown to affect memory. A lot of them have autoimmune problems that are systemic. Sometimes those autoimmune problems are specifically killing the cerebellum. And we found early on in 2008, 2009, 2010, with these patients, when I would try to give them brain stimulation exercises, they would maybe do a little bit better and then they would crash.
And that's the way it was being taught. That's the way it was being taught. That's the way functional neurology was being taught. You just have to do the brain. And there was kind of not yet an embracing of changing the diet and things of that nature, not to the degree that there is now.
Probably not to the degree there is now. And I would say because the information quite wasn't there.
Okay.
At that point.
Okay. This is where the two professions kind of come together. This is where like the functional medicine guy, Karazian, was, he was a functional neurologist who started working with the functional medicine world and started, I think he really has to have some credit for ultimately bringing the two things together there.
And we'll talk about how the balance has kind of been set off between functional medicine and functional neurology. Yeah. But there was discussion when I was going through my training about underlying metabolic causes mitochondrial dysfunction, things we could do, abnormal breathing patterns in patients that were causing them to be more fragile. So basically, as in functional neurology, it was all about, okay, we got to stimulate the nervous system, but we have to look and make sure we're not overstimulating it. Kind of like going to the gym. You don't want to put 400 pounds on the bench press your first day there. You're going to tear a muscle. And from that, Dr. Rutherford and I kind of started coalescing our disciplines and then seeing, okay, for a lot of these patients who we're seeing, they have autoimmune and inflammatory problems. By correcting their gut, by calming down immune issues and inflammatory issues with them, which are detailed in all of our videos, then coupled with neurological rehabilitation on the neuroplasticity side, we started seeing phenomenal results.
Yeah, and this
far
was
more superior than anything we had seen before.
And yet this was the challenge for me, because right now what I do is I do the intakes, I do part of the exams, I talk to people about what their program is going to look like and so on and so forth. And one of the biggest challenges is that person who comes in with a neurological problem, and they've come in with dizziness, vertigo, migraines. They've come in with balance problems, which are all brain issues. And then I had one yesterday, the gentleman came in with migraines, and fortunately he was with his wife, which is usually a good thing. When the guy comes in and the wife is there, that's usually a good thing, because she's usually going to squeal on him, which she did. And he insisted, I don't have a problem with my gut. I don't have a problem with anything. He could not come to grips that more would need to be done than to work on his brain.
Right.
By the time we were done, he kind of embraced it, because it turned out he did have a seriously bad gut. And then he did start to connect things and so on and so forth. So this was the uniqueness of putting the two together. And ultimately, sometimes people will come with a thyroid problem. They want to understand why we have to work with their brain, because you stated most of our patients have autoimmune problems, and they do. But most of our patients also have like mini to mild to severe to moderate post-traumatic stress syndromes. And a lot of them don't know when they come in, but they have a stress mechanism in their brain that's flooding everything with cortisol. Those are the two commonalities that I see the most when we see that. And so the one doesn't want the brain work, and the brain work doesn't want the function work. But let me tell you, they are like that.
That is the
and as Dr. Gates said, once we got them together, once we started doing a lot with the gut,
we started seeing
the brain function improvement from the functional neurology and the neuroplasticity exercises was dramatic.
Yes, very dramatic.
It was dramatic.
And then other practitioners circa this time, due to popularity of Dr. Karazian's book, Why Do I Still Have Thyroid Symptoms When My Lab Tests Are Normal? And kind of the explosion of functional medicine within the chiropractic, medical, naturopathic, acupuncture realms, those disciplines, more and more dietary, nutritional, supplement-based treatments for autoimmune and inflammatory conditions came to the forefront. So now everybody out there is calling themselves a functional medicine practitioner, even though this gentleman was probably one of the first ones in this state, first two, to be accredited. And so now everybody out there is trying to tie in, well, we're going to fix your gut, we're going to fix your depression, we're going to fix your gut, we're going to fix your neuropathy, you're going to take this supplement, your neuropathy is going to go away, you're going to take this and this diet, and your fibromyalgia is going away. And so the balance is tipped that direction, frankly, and there's no criticism intended though, but functional medicine, learning that is a lot easier than going back and learning neurology as a discipline.
Well, it's easier in a lot of ways. I think I think most of us have the background coming out of chiropractic college or naturopathic school or medical school, for that matter, to assimilate the function of the systems better, because most of us get a course. I got a pretty good course in neurology from a very, very prominent teacher. But neurology is not easy. And to be able to apply neurology in the way functional chiropractic neurologists apply it has to be very precise, based on your understanding of the brain and based on the understanding of being able to apply different stimulations specifically to the area of the brain and so on and so forth. That's not easy. The other thing is that board certified functional neurologists are tightly regulated. They're actually regulated. These guys, man, they take a lot of courses, which I'm kind of a non-board certified, non-CARIC trained neurologist, because I want to use it as an example, because I took several courses from CARIC trained neurologists, and it's not the same. to put anybody down out there, okay, but I've done it. And I'm not dumb, okay, but when Dr. Gates came along, it was like, okay, you do the neurology stuff. Because there's like 4,000 people who've gone through the course, I think. I think it's in the ballpark of figure. And there's like, the last I knew, and there may be more now, okay, but I mean, the last I knew, was like 400 actually certified functional neurologists in the country, because you have to go through a rigorous testing procedure. And it's both verbal, and it is, so it's oral tests, as well as written tests. And so in functional medicine, that doesn't exist. There's a couple of good courses. There's Functional Medicine University, there's Functional Medicine Institute. One's 200 hours, the other one's 250 hours. And really, there's no certifying board. So in my opinion, you shouldn't probably be able to call yourself a functional medicine doctor. And in this state, in fact, you can't. Well, you can't advertise in this state as a functional medicine doctor unless you've gone through one of those courses, because functional medicine is a discipline that requires your understanding of all the possibilities of what can be affecting the system. But still, it's not regulated. So as Dr. Gates said, you might have somebody go and take a seminar. It might be 25 hours long on the thyroid, and then go out and say, I'm practicing functional medicine on the thyroid. But yet, they're practicing this when actually what they need to know is this. So that's, so it's way easier. And that's why it's tipping towards more people going out there. I've talked to functional medicine doctors and said, you know, what do you do for the brain? And they go, oh, I handle it a different way. And they handle it by giving you neurotransmitters, dopamine, serotonin, 5-HTP, melatonin. But even Dr. Karazian, who was probably the guy who really tipped it over in that direction, I think kind of sort of accidentally, will say in his books, he's got a book called Why Isn't My Brain Working? In there, he will say, using those methods is just a Band-Aid. He will say that is, and the book's all about that. The book's all about functional medicine. But in those books, when he goes through his treatments, he'll say, you can give people dopamine, you can give them serotonin, you can give them 5-HTP. But the reality is if you have brain malfunction, if you have functional brain abnormalities, it's just a Band-Aid. You have to find the underlying inflammation, and then you have to work with the brain to get it to start functioning normally again. So I don't know if I...
No, and that's good. Okay. And unfortunately,
that's how I explain it to people who come in and ask. So,
and the balance even tipped in the functional neurology community, where a lot of guys started going that direction, because doing functional neurology or chiropractic neurology, it's difficult. Yeah. I can't tell you how many thousands of hours I've spent, you know, in terms of self-teaching, because you have to just go back, you have to know neurology, and then you have to learn functional neurology, and you have to apply it with patients. And this is pretty much all we've done since 2009. And
one last thing, people already are drilled into vitamins and supplements, and now most recently diet, where our patients will get so much better. And some of them, I mean, we've had some pretty brilliant patients come through here. I mean, heads of departments at famous schools and engineers and just all kinds of people who are pretty well educated, and they're getting better. And halfway through the program, I'll say, so Vince, if you're watching, I'll say, so do you know what this is doing? This is a cerebellar exercises. Doing this is to your cerebellum, like doing this is to your bicep. And Vince goes, no, I'm not really sure that I understand, because they have zero frame of reference when they come in here for that. And it's one of our biggest challenges, is to help people to understand why they're getting better and why these exercises are so powerful. And they're powerful if you do them, but they're only powerful if you do them if a proper diagnosis has been made. And if someone understands the brain to such a degree that not only do they know which part to take care of. And one of the most amazing cases I've seen in here, and it was a gentleman who took a big hit to the head, and he had no balance. He had he was on
a
catheter because he couldn't go to the bathroom. There was a number of things going on, and when I was there when Dr. Gates first worked on him, and you stimulated the part of the brain that was damaged, he got worse. And within minutes, because of the acute understanding of how the brain functions, Dr. Gates was able to move to an adjacent area of the brain. This is within minutes. and then do a different stimulation at a different level. And he immediately was able to stand and able to walk. This guy couldn't walk. He couldn't walk. By the time he got done, he could walk. His catheter was gone and all that type of stuff. But the point being, even the exercises are only really powerful if that person is a board certified functional neurologist who knows what he's doing and isn't just applying things in general like I was doing before. And we were getting results. But we couldn't have handled anywhere near, because I was studying chiropractic neurology from the assistance of Dr. Garrick. And I was getting a lot of general information, and we were getting better results than these people had ever gotten before anywhere else, but nothing like what we're getting now. So,
and that's really where we got to credit Dr. Garrick, because he emphasizes taking it to the next level. He emphasizes doing a precise and good job within this discipline. And, you know, the training process and the examination process really screens and makes sure that you're able to do exactly that. And so I'm very thankful to be a part of it, you know, not just to be at nauseam, but to be a part of a group that has had a standardized testing board to certify high standards to get into this discipline and call yourself this, even though there's still a ton of stigma with, you know, chiropractic. That's okay, because we're now actually kind of changing the currents in this area where we're at, where doctors are kind of coming on board with what we're doing and acknowledging that, you know, we're getting some pretty neat results.
We have very good relationships with the medical community.
So the balance, as we were saying, was kind of tipping in the wrong direction. So it's functional medicine based for a lot of these neurological issues. And you just need to know that it's kind of analogous to, you can go to the gym. If you're not eating correctly, it's probably pointless. And if you're eating correctly and you're trying to look like a bodybuilder, that's probably pointless too. You have to couple the two together. And that's where things really start to happen. So we use functional neurology in our clinic, and chiropractic neurology as it applies to a number of conditions. Some of the highlights are chronic pain. A lot of our patients have fibromyalgia, Lyme disease, horrible disabling pain, and they wonder why they're doing these exercises. We attach some articles to today's broadcast detailing kind of how we feel pain in the brain. We feel pain in the area of the brain termed the parietal lobe up here. It's behind your frontal lobes. And the parietal lobe is where you feel everything going on. And they've done studies where people with chronic pain don't perceive information the same way as someone who is healthy. So they've done experiments where they'll put electricity into the wrist, and a healthy person, they see it light up in the parietal lobe just as we'd expect from a neuroscience textbook. The parietal lobe lights up perfectly. And someone with chronic pain, when they stimulate the wrist, they see that the emotional centers light up, other brain networks light up, in addition to the parietal lobe. And the part of the parietal lobe that lights up is actually not even the correct part. And I find that to be very fascinating. That's very cool. And so we will do electrical stimulation with parietal lobe remapping exercises. And we also do things to get our patients out of this chronic PTSD-like state that so many of them are in from previous abuse, going through divorces, on and on and on. Because until those phenomena are unwound in the brain, so to speak, lots of times chronic pain patients won't really start to feel better.
Yeah, and if you want to know if you're in that, a couple of things I find are very common in patients are they get anxiety when they don't think that they should. Like, why did I get this anxiety? And maybe they get a short temper. They think, like, why did I do that? But a big one is if you're like one of those who can't go to sleep at night, your brain's going like 1 billion miles an hour. And then you finally get to sleep and you wake up, can't go back to sleep again. Good chance that you have this stress mechanism that we see. It is unusual for us to have a chronic pain patient here and only do functional medicine. It happens occasionally, and that's based on our history and it's based on our exam. But to have a patient that comes here who does not have these stress mechanisms engaged is unusual. And the key is that emotional component that Dr. Gage just briefly mentioned, where he said it lit up the emotional part instead of lighting up the part that it was supposed to light up. And that emotional part, once that gets involved, it is staying there, and it's bad. It's going to cause bad chemistry throughout your body. And you wonder why I just went on this diet that I read in the book and my stomach got better, and 6 weeks later it's bad. It's because you may be going through one of these post-traumatic stress syndrome type of things. It's flooding your system with cortisol. And one of the things it'll do is damage your stomach. So that didn't work. But the big thing it'll do in this particular case is it'll damage your midbrain. It'll cause short-term memory loss. It'll contribute to the to the brain fog that so many people come in, really hits your left brain. Maybe you can't find your words as well. Maybe you're not as academically inclined as you used to be. It is a big friggin' deal.
In fact, we attached an article just on that. I didn't know you were going to say that.
There you go.
Hippocampal
I'm just telling you what we see.
in fibromyalgia patients. The hippocampus is the memory area of the brain, and they talked about how cortisol was causing the hippocampus to shrink in size, which is fantastic for Dr. Rob Sapolsky, who is the world's foremost researcher on stress, who's been saying for decades now that elevated stress hormones cause memory impairment, and he's been lambasted for that.
I'm the functional medicine guy and the pseudo functional neurology guy here. So
neuropathy. Neuropathy is another major area that we treat in our practice or manage. And neuropathy patients tend to have numbness and tingling or burning in their feet, can spread up to their hands. Think of the electrical wires going down into the legs or the hands as either dying and degenerating, so the wires like fraying, or the insulation around the wire is coming off, and that is why these individuals have these symptoms, usually due to some metabolic process, most commonly diabetes, but it can be nutritional deficiencies and autoimmune issues. And we go in, while addressing the functional medicine aspect, we go in and we do electrical nerve stimulation with these patients. We do laser, sometimes we use vibration to start making these nerves work better. And these therapies have been shown to do that, but they're temporary in the experiments because the underlying metabolic problem, diabetes, nutritional deficiency, has not been addressed in these research studies. So that's where we put together this paradigm and have seen some really, really cool results with neuropathy. And that's where patients with neuropathy also have been shown to have degeneration of their parietal lobe, which is the sensory area of their brain. So sometimes neuropathy patients will say, well, why am I doing this eye exercise? Well, because your parietal lobe is shrunk based on probabilities.
Yeah, your parietal lobe is where all of these nerves they're supposed to be feeding back to. And one of the things that your brain needs to function right is activation, what we talked about before, use it or lose it. Well, when you're not feeling anything there, they're not firing back to here, you're not using it and you're losing it. And so Dr. Gates is indicating you got to fix the brain if you want this thing to stay away. And I used to do a talk on that, and I used to talk about the parietal lobe. And you know what? Still people, that talk's still online, and still people, that really lights them up more than anything.
Because they had no idea.
Because they had no idea that the parietal lobe could have anything to do with their feet either getting better and or staying better. Indeed, we got addressed by the board on that. The board calls out, you said that the parietal lobe could be said. So we spent one whole Saturday sitting there studying all these studies going, you're damn right, it can have a lot to do with it. And the person who complained about that should go look at all these studies. But yeah.
And really, that's one of the main reasons why, too, possibly the neuropathy patients don't improve, because their brains actually change. It's so analogous to somebody who loses a limb.
Or they improve and then they don't.
Right, and they lose a limb and you lose the nerves down here in the arm. And they've shown that the parietal lobe, the sensory area of the brain, actually remaps itself. So areas that used to encode the face and the shoulder now start growing into this area of the parietal lobe that encoded the arm. And they develop this exquisite burning pain. And if you touch their face, sometimes where their arm was, it begins to hurt, or their arm burns all the time. So that's termed phantom limb pain, and it's very analogous, or neuropathy is very analogous to phantom limb pain from a neurological perspective. We manage dizziness, vertigo, and balance conditions. That's a whole area unto itself with many complexities between what's termed peripheral vertigo, which involves the inner ear, and central vertigo, which involves the cerebellum. In essence, the cerebellum we have found to be one of the most responsive areas in the brain to our forms of neurological rehabilitation. Eye exercises can be incredibly precise in terms of rehabbing the cerebellum. And again, you have to assess individuals with cerebellar disorders. Are there autoimmune components? Frequently there are. We had a great case of a gentleman who had Meniere's disease, and he was set to have his inner ear cut out and the nerve cut out from his inner ear because he had vertigo 23 hours a day, not kidding. And then we determined that he actually had a cerebellar condition on top of that, and in correcting the underlying cerebellar condition from an immune perspective, as well as a rehabilitation perspective, he no longer has vertigo or dizziness and is a happening guy. Restless leg syndrome is so on the lines of neuropathy. In fact, now they're calling a component of it neuropathic restless leg syndrome. And that's where neuropathy patients and lower back condition patients, where a nerve is entrapped in the lower back, they lose the sensation from the feet going up to the brain. And because of that, the brain, in addition to some other problems such as with iron stores in the body,
Not getting activated.
the brain is not getting activated. So as a result of that, they have this tendency to start moving their legs when they're laying down and they're not getting activation from their legs. So what do? They get up and they walk around, they feel better, and then they go and lay down, they feel the sensation that they need to move their legs again. And we have found through increasing sensory feedback, through functional neurology, as well as doing eye exercises to get their frontal lobes working better, that we've had some pretty neat things.
Yeah. In all of these cases, you're going to find that the brain needs oxygen, and smoking doesn't supply oxygen to the brain, just for the record. It reduces it dramatically, but it needs massive amounts of oxygen. It needs proper blood sugar. Okay, so blood sugar is a big deal that needs to be addressed when you're doing brain work. It needs a lack of inflammation. That was something that wasn't being taught when I was going through it. They were just saying it needs proper glucose, proper oxygen, and activation. Those are the things that you need to be able to make those brain cells that doctor, whose name I can't remember, in 1937 founded.
Yeah,
those brain cells work. And then you need a lack of inflammation. And if you don't do that, again, as Dr. Gates stated, that these things are not going to work. And the activation, we've always understood it, use it or lose it. You know, and a lot of these brain issues are happening because they're not getting activated. My shoulder, I'm sure I had a shoulder dislocated years and years and years ago, and I'm sure that it has something to do with the issue of my cerebellum not feeding back there, because this thing they got dislocated. I never had surgery on it. It's never been the same. So, and I can kind of notice it. So it's because it's not sending back to the brain the proper signals from that area. It's kind of an interesting concept. If you really understood neurology the way Dr. Gates understands it, and the way certified functional, board certified functional neurologists understand it, you'd understand you have a bad knee, you have a hip replacement, you have a fusion in your back, you have a fusion in your neck. People kind of get the fusion in their neck because I guess it's because it's close
to the brain. Yeah.
You have a shoulder, it's not working. It's affecting your brain. It's causing your brain to be abnormal. Then all of a sudden one day you start maybe losing balance or something. You're going like, what is this? Go to the doctor, they take an MRI of your brain, go, yeah, you're fine. How many of you would think it would be bad feedback from a part of your body down here? But it is.
Yeah, that's a great example. And that ties back in with what Dr. Carrick was talking about back in the 80s and the 90s. He was terming it deafferentation, which afferent means going to basically the central nervous system. And we're losing that afferentation from the joint in the chiropractic situation where a joint is stuck and you adjust the joint and all of a sudden the signals start going again. Well, that's now being applied in the literature to neuropathy, chronic pain syndromes, reflex sympathetic dystrophy, on and on and on, carpal tunnel syndrome even.
So if you go to a chiropractor and he adjusts your back, or she adjusts your back now, when I went, there was no gals involved. And it doesn't work. It could be you, not him. Could be your spine. Could be what you're doing to not allow those adjustments to work, or not allow that to work from a physiological point of view, the immune problems, the blood sugar problems, those types of things. Or maybe you have a previous back surgery that's not going to allow it to work. So
then just the last, a few other conditions. Yeah, post-concussion syndrome, mild traumatic brain injuries. These are patients who fall and hit their head for some reason, and they can have disabling consequences due to these head injuries. And we have found that these patients, oftentimes because there's a lack of underlying inflammatory problems with them, as opposed to like an individual who has lack of balance because they're eating gluten and gluten is attacking their cerebellum. These individuals with brain injury seem to respond pretty well to what we do. And Dr. Carrick has really caught on to that way before anybody else. And he saw that you could stimulate their damaged areas of their brain pretty effectively, or go into other areas of the brain that talk to the damaged area of the brain and get that area kind of resynchronized again, kind of like getting the car firing on all 8 cylinders. And we've seen that in our clinical practice too, with really, sometimes these are the most fun cases because you'll just see dramatic changes in real time quickly. You'll know if what you're doing is working or if it's not working, as Dr. Rutherford alluded to in that example. And then depression and anxiety, as Dr. Rutherford said, so many of our patients have kind of like a mini PTSD or chronic anxiety or chronic depression causing chronic anxiety. And the linchpin there is frontal lobe function. The frontal lobes have to have good integrity to shut off fear-based responses in our brain. And medically, they use antidepressant medications that in essence put more chemicals into the little area between your nerve cells called the synapse. And that can cause people to feel better and feel less anxious. Our approach is, well, let's be very specific and let's exercise the frontal lobes where they're not working well in conjunction with doing other things to calm down stress responses. And we actually have a patient right now who has a esophageal stricture due to anxiety, and she ate steak over the weekend. This is a gal who couldn't eat anything. She couldn't swallow a milkshake.
Right.
And she ate steak over the weekend. So pretty big advancement. And finishing up, I want to talk about why our eye movement is so important. As Dr. Rutherford said, so many patients don't understand what this is doing. Well, we know that this is strengthening a bicep, as you said, and we know this is very, very powerful for a certain part of the cerebellum. And if I gave you that exercise, you're doing that exercise because that part of your cerebellum is not working so well. And we have many modifications to this exercise as an example, that can also make that exercise more powerful, more involved, and more specific. The Neurology of Eye Movements is really the text. The Neurology of Eye Movements, as I said, there are thousands of references, but really this book was written by one gentleman from Johns Hopkins University. And each chapter has upwards of 1,000 references as to how we understand every little nuance of every eye movement. From you just moving your eyes from left to right, that's a whole chapter with 1,000 references as to how that occurs in your brain. It is phenomenal, the detail which we know neurologically what's going on. So that's why we use this data, because we know based on probabilities, we can do an exam when you're first here and see, oh, well, your eyes are not moving correctly. So that means this part of your frontal lobe is not working well. And that part of your frontal lobe communicates over here to another part of your cerebellum. And then we can give you an exercise and see, is there a change or is there not a change? And if there's not a change, then we need to give you a different exercise. But if there is a change, that means that area of your brain is now starting to work better again, and we can monitor that through time. And that's what Dr. Carrick has promoted.
Yeah, and there's hundreds of exercises and strategies for doing that. So if you get a number of people in with the same problem, it's not necessarily going to be the same exercise for each one of them. And it's not necessarily going to be the same intensity for each one of them. The same number of exercise. Oh my God, when I first started doing them, I would do 3 of these. I would start to get dizzy and woozy. So I had to do 2, and so naturally we think more is better, but that's not the case. So it's so variable from case to case, from patient to patient. And it has to be, for it to be effective, it has to be so precise. We do cases now that used to take us a year or 2 that take us 4.5 months. And sometimes 6 months. We rarely go past 6 months anymore. And I have a video here that I have to change, because we had the patient watch the video before they see me, so that they kind of like know what they're getting into before they talk to me, so that they can either say, maybe this sounds really good, or maybe this doesn't sound so good that I'm going to have to do all this work or whatever. And in there I say we do treatment of 3 months, 6 months, 9 months, 12 months, 18 months, and sometimes 2 years, because that's what we used to do. But really, mostly, we rarely have more than a 6-month case now. Most of them about 4.5. A rare occasion, maybe we've had 2 9 months in the last year, or something like that. And it's because, what I point I wanted to make was it's because of the continue, and you're going to talk about new frontiers, but it's really about the continued precision with which we're applying the neurology in those specific cases, and being able to give that patient more stuff to do at home that's more precise. It's really about precision. I mean, as I said, I'm kind of a pseudo neurologist. I had taken a number of courses that weren't certified by Dr. Carrick. They were decent courses. I was getting decent, but I was doing very general work. Just about the time Dr. Gates got here, and I'm a pretty motivated guy. I don't like doing half a job when I know a better job can be done. And just about the time Dr. Gates got here, I was thinking, man, I got to go take this certified. I got to take Tarek's courses, because we need to get more specific so we can get these people better, quicker, higher levels and stuff like that. So again, the thing is about functional neurology being explained, and I'm just trying to go through all the aspects, because there are people out there, who are functional neurologists who don't do this work. But maybe you'll go in and maybe they'll see a chance to have a patient, and maybe they won't remember it all. You want a board certified, I don't mean to be like promotional here, but you want a board certified, Carrick trained neurologist who has passed the board certified. Because that tells you those people are serious, they know what they're doing, and they've been passed, and they can do what we're talking about here. And yeah, there's only about 400 of them around the country, but if you're going to do it right. Get somebody who knows what they're doing.
Yeah, and thanks to the American Chiropractic Neurology Board too, because this is a semblance of several individuals who put together the rigorous standards for which someone like myself had to pass through those examination procedures.
So for these people with neurological diseases, all three of them that are probably watching here, well, we know maybe there's 10.
No, actually, we've been getting
I know we have a lot of people. I know that we have a lot of people watching. So, but what do you want to tell those folks? You want to tell them in general? You want to talk about new frontiers? What do you think they need to know about? I mean, really, I'm going to tell you, this is where neurology is really expanding, because even though the data is there, even though all of the work that these very dedicated doctors do is based on mountains and mountains of research. In the medical field, they're primarily being used for drug development and probably new surgical procedures, and like maybe some understandings of don't bind the arm that needs to move, things of that nature. They've resulted in some general exercises that I see coming from physical therapists who don't have a background in neurology. So they go to a course and they have people doing this type of stuff. But really, again, not to sound promotional, but this is exciting for us, because this is really where that data is being taken and being applied in ways that are creating new types of approaches that are helping people's brains, mostly without drugs. And we're not anti-medicine. So like I said, we have a very good relationship with most of the medical field that we work with. And but this is kind of where it's really advancing. So what do we have? What can we expect in the future?
Well, new frontiers. First, we want to acknowledge, again, I'm go back to it, Dr. Carrick, because within our profession, a lot of people are shifting away to the nutritional based treatments. And Dr. Carrick has really pioneered the field of functional neurology, not only maintaining that individuals like myself have to know neurology from a medical diagnostic perspective, but understanding neuroscience from a rehabilitative aspect. And with the data he has brought to the table, with the new data that's out there on these conditions that we're talking about, with the new metabolic data, those with neurological illnesses, I feel, most neurological illnesses. Now, sometimes there are other ones that are neurodegenerative and maybe we can't do as much about it as we'd hope to. But for a lot of neurological illnesses, once claimed to be, it's a chronic, lifelong problem. You're just going to have to go home and live with it, or
manage it with medication,
or you're faking it, as some of your neurology friends have said to you. 80% of the time it's in their head. You need to know that there are new treatments on the horizon, and even though they may not be performed always at Harvard, or your local neurologist may not be aware of it, because your local neurologist is practicing medical neurology. They have to make a diagnosis, they have to give you a drug or send you for a surgery or tell you there's nothing that can be done for it. That's all insurance will allow them.
And they're looking for pathology. They're looking for tumors, they're looking for cancers, they're looking for something you can see on an MRI.
Right.
They're not looking for functional abnormalities.
Right, and we have to look at those tumors and those strokes as well, but we start looking at the functional abnormalities and how we can rehabilitate your nervous system. And that's why it's so exciting in terms of working with chronic pain patients, fibromyalgia, neuropathy, restless leg syndrome patients, dizziness and vertigo patients, depression and anxiety patients on this level, because we're seeing a whole new realm of possibility, from the concussion syndrome patient who's here right now, who's getting his life back, to the neuropathy patient
who's an anesthesiologist, I might add, who wants to know why we're having so much fun in our job and he's not. He's a great guy.
He's an awesome guy.
He's a great guy.
He's an amazing guy.
Oh, you might be watching.
Yeah, he is watching.
Ah,
he always watches.
see,
He always
good thing
watches,
I said that.
To the neuropathy patient, all of a sudden can feel their feet again, to the gentleman who has vertigo 23 hours a day and wants to kill himself to all of a sudden now he's completely dizzy free. I didn't even tell you, he hiked 23 miles last week, one day, 17 miles another day. These are the types of possibilities. Now, of course, nothing's perfect, but we do a pretty good job of screening patients to make sure that they're going to respond to what we do. And as long as they keep doing what we tell them to do, which is our next broadcast here in about 3 seconds,
To our
these
patients.
things should be maintained for the most part. So we appreciate you watching. Go to powerhealthtalk.com if you have other questions. We have a lot of people emailing us from all over the world. We have a brochure on there if you're interested in us evaluating your case. Again, this is not promotional, but that's just on there because we can't field questions anymore because we have so many. So anyways, that's the information, and thanks for watching, and tune in next week.
Yep. See you next week. Thank you.